In Trinidad and Tobago, although there have been no recorded statistics on the prevalence of various mental health challenges, clinical psychologist Victoria Sunarayan Jilal Singh says there are more people seeking help.
So there aren't any statistics because there aren't any formal studies that are being conducted. But what I can say from practice and what I can speak to based on things that I've been hearing from my colleagues as well is that more people are seeking help. Now, if more people are seeking help, it doesn't necessarily have to mean that the prevalence is higher. It can mean that. But what it does mean is that more people are recognizing that there is something that can be done and they are actually being actionable about it and trying to get the help that they need from professionals to help them recover.
Distinguishing mental health from mental illness is a distinction the psychologist says is important. Depression and anxiety are categorized as mental health, while mental illness is more severe.
Not because a person experiences challenges in their everyday lives means that they may meet criteria to be diagnosed with a mental illness. So that's where the difference lies, where a mental illness rather are things that we can diagnose, where it's severe enough that that person meets criteria to seek treatment for it.
Labeling and judgment has created a stigma about therapy, an issue that has stopped many from accessing therapy.
I think the labeling of persons as mad or crazy is a defense mechanism of people who generally don't really understand the dynamics of what it may mean to meet criteria for a mental illness, or even people who themselves have challenges in their own mental health, and because of that it makes them feel a bit insecure, so they then put forward their defenses of their own. Anything that presents to them as that and it comes a little bit too close to home, they try to hold it off as best as they can.
Therapy sessions are categorized into individual, group, family, and couples therapy, all curated to offer unique benefits to individuals. Apart from cutting costs, group therapy offers a sense of community rather than individualism.
In group therapy, you get to be in a space where you can feel a sense of belonging. You don't feel as though you're being stereotyped because you're in a room with other people who are going through very similar things. And it gives you that sense of camaraderie, that you have a friend in it. You have somebody to hold your hand while you walk through it. And if you fall, then somebody is likely to give you a hand to help you get back up.
Mental health is a sensitive and individual experience. Therefore, it is important to ensure ethical practices and confidentiality in any professional setting.
Ethics really is just a guideline to manage us, to make sure that we don't overstep. We don't put anybody in a position that's going to make them vulnerable. We don't put anybody in a position that's going to harm them. It's one of the reasons why confidentiality is so important in therapy.
Mental Health Awareness Month therefore serves as a critical way of pushing efforts towards education and information. Information is available through the Trinidad and Tobago Association of Psychologists website and through their social media platforms. Cheruiyot, TTT News.